Medical bills are a leading cause of debt here in the U.S. A new locally based nonprofit called Costs of Care has a simple but daunting mission to give patients and healthcare workers information they need to make medical costs go down. And Costs of Care is organizing a special contest to help spread awareness. Dr. Neel Shah is founder and executive director of Costs of Care. He's a resident at Brigham and Women's Hospital and has degrees in medicine and public policy from Brown Medical School and the Harvard Kennedy School of Government. And of course, we all know our own Dr. Tim Johnson. Dr. Tim is chief medical editor at both WCVB and ABC News, and he's one of the judges of the Cost of Care contest. Welcome, doctors.
Thank you.
How are you both this afternoon?
Fantastic.
Neel, tell me about the Cost of Care. When did you found it and why?
I started it as a graduate student just before starting my residency. And the reason that I started it is because, I had an opportunity to be trained at some of the leading academic medical centers in the country with some of the most caring and compassionate doctors that you can imagine. But I found that even the most thorough doctors sometimes were not forgetting, but just not considering an important part of the equation, which is that medical bills are a leading cause of personal bankruptcy in this country. And we're the ones that decide what goes on the bill, but we often just don't know how the decisions we make impact what patients pay for care.
Now, Dr. Tim, I know that many organizations approach you about getting involved. Why did you decide to work with Neel and Costs of Care?
Because Karen and I become absolutely passionate about the need to try to control costs in this country. We are headed for national bankruptcy, in my judgment, in less than 10 years, unless we start bending the curve the other way. For the last 10 years, healthcare costs have gone up 13% a year versus the general inflation rate of 2 to 3%. That's just the formula for financial disaster. So this effort fits right into the concern that I have for our country and for all of us as individuals.
Now tell me how Costs of Care plans to help bring down medical bills.
Yeah, and as Dr. Tim has spoken about many times, the problem of healthcare costs is very complicated. And to solve it, we definitely need leadership from our policymakers. But I think there's something that we can do on a grassroots level as well, given that we're the ones that decide what goes on the bill. It's decisions that patients and doctors are making together. At the same time, we know that a lot of the things that we decide to do don't really help patients get better and cost them a lot of money. It can even be harmful. We spend $800 billion a year on medical tests and treatments that don't improve healthcare outcomes, which is almost the amount of money that we've spent on the Iraq War. So we think just by sort of creating a cultural paradigm shift where
Tell us how you're going to do it. Tell us how it's going to work.
Well, we have a social media campaign that's trying to sort of raise awareness of the different costs of medical tests. And now we're launching this essay contest, which we think is going to bring about anecdotes of everyday examples all across the country of situations where having more cost awareness would have made a difference for both patients and doctors.
And you're going to take an innovative approach to using information technology as well as part of this.
We are. We're a nascent organization and we're still working on doing that. But the whole point of information technology is to take information and put it where it's supposed to be when it's supposed to be there. And often it's not that costs, they're definitely opaque, but it's not like they're not things that are possible to find out sometimes. They're just not there when decisions need to be made. So right now we have a mobile application for iPhones that's in development that's hopefully going to help do that.
It's very exciting, isn't it?
Well, and I think that the contest itself is really gathering stories from the front line, from the trenches, if you will. We can talk at the theoretical level, and we need to do that, obviously. But sometimes a true life story about how health care costs got out of control, provided unnecessary and dangerous care for an individual, or how a doctor made a decision that turned out to be disastrous and cost too much money. If people are willing to tell their own stories, as we say so often, a story may be worth 1,000 words of theory.
Sure, and so what you're doing with this contest is doing a major outreach to solicit stories from everyday people. There's going to be a judging panel. Dr. Tim, you are a part of that.
Oh, yes, and we've got a few other very distinguished people. So we'll look at these winners at the entrance and pick a winner on the consumer side and on the professional side. And I'm looking forward to reading these, both because I'll learn something about a subject I'm so passionate about, but because I hope we find stories that will be instantly meaningful and understandable to the public in terms of what we all have to do to try to control costs.
There is a cash prize involved for the winner, and we should also say that all of the major healthcare companies in Massachusetts are also a part of this as well, right?
Yeah, no, it's very exciting. We have a lot of the major health plans, the
Blue
Beth
Cross,
Israel, Blue Cross, Tufts, Harvard Pilgrim, the Beth Israel Medical Center are all sponsoring it. We're going to offer $1,000 prizes to the best anecdote that we get, one from a patient. It's very important to us to get stories from patients, but also one from, as Dr. Johnson said, a professional, a doctor, a nurse, a medical student.
The anecdotal research, I would assume, through this essay contest is really important because it puts a face on some of the problems and takes it out of the theory into the reality of what people are dealing with.
And that's what we do in television all the time, obviously. We try to tell stories. That's our bread and butter. And too often, I think the issues of healthcare policy have been left at the theoretical level, where it's talking heads and experts, and the public doesn't really relate to it. Hopefully, these kinds of stories will bring it down to real life.
And Dr. Tim, with you here, I have to ask you some questions about the national scene in terms of the progress of healthcare. I know you had an opportunity to talk with President Obama before the bill was passed. What do you see now in terms of implementing, how to get it out of the politics into practice?
Well, right now, it seems almost hopeless in terms of getting it out of the politics, especially leading up to the midterm election. Maybe after that, in leading to the presidential election, we'll be able to elevate it to a more thoughtful level. But many of the major parts of reform, especially those designed to control costs and improve quality, don't really kick in until 2014. The exchanges, for example, where people can go and choose policies at the state level, are not operative until 4 years from now. So I'm very worried that many of the things that need to be done won't be done for 3, 4, or 5 years, and I think that's going to be too late and too long.
Now, we know it was not a perfect bill when it was passed. What would you have liked to have seen added, or what needs to be tweaked, if you will?
Well, I think many of the elements of possible reform are there. Excuse me, Karen. But what we don't have is a kind of coordinated national system. So it's going to be the continuation of all of the chaos that we now have. What we've got to have is a national computer system that helps doctors and patients know where their records are and how to do things right. And we have to have national standards for safety and for cost and quality. And to me, that's what's still missing. And I think eventually it's going to get so bad in this country that we will have those things, but we're going to go through a painful period. Well,
Dr. Tim and Dr. Shah, thank you for joining us to talk about costs of care and your efforts at kind of getting to the heart of what's wrong with our healthcare system by reaching out to everyday consumers. And we want people to participate in this cost of care contest. Entries must be no longer than 750 words and should be typed and double-spaced. The deadline for submission, November 1st. And if you win, you could win $1,000. That's not bad. We'll have more details about how to submit your entry on our CityLine page on thebostonchannel.com. Up next, how to become your own boss, even in a down economy.